Welcome, everyone. Today, we are very excited to have Christine Xavier, Senior Living Advisor with Creating New Hope, specializing in providing seniors with complementary advocacy, education, and assisted living referrals. Christine has spent 10 years serving as a local advocate, case manager, and as a mental health counselor. After being appointed as her grandmother's conservators due to her Alzheimer's diagnosis, she founded Creating New Hope out of necessity. She has a BA in psychology, is a certified RCFE administrator through the state of California. So, Christine, let's start. As we age, living in our own home without support becomes very challenging. What are the typical options available for our elderly population to overcome this?
So there are a ton of untapped resources available to seniors to live independently in their home for as long as possible, such as home safety evaluations, where a professional will come out, install grab bars, anti-slip mats, ramps, etc. There's also in-home care organizations like Comfort Care that can come in and bring caregivers into your home and help with activities of daily living. There are also home health services and various technological resources that can be a great aid in living independently as long as possible. And a great access and resource to get this information is definitely reaching out to your local National Aging in Place chapter, like ourselves, the NAIPC Bay Area chapter.
And when the time comes and there is a need to move out of the home, it's very overwhelming for all of us, and especially for our seniors, because there is a feeling of uncertainty at that age and the fear of the unknown. So, what do you have to say to people who are reluctant due to not being aware of the many benefits of moving into a senior community?
So if you need support, if you need community, simplicity, and a maintenance-free lifestyle where you don't have to worry about paying bills, cooking, cleaning, managing an entire household, an active senior living community can be very beneficial for someone who is looking for a simpler life and to have a community and not be isolated, especially during these times. You know, your meals are provided, you have care at the ready, and activities that you can participate in, as well as transportation to doctor's appointment. There are just so many benefits to living in active senior living communities.
Yeah, living with like-minded, similar tastes and all that. So it definitely has lots of benefits.
Absolutely.
The pandemic has really made it difficult. And some people get nervous thinking about moving to a community because there are so many residents in a building, you know. However, senior communities are taking extreme precautions to keep everyone safe. So can you please give some examples of the protocols that are in place?
So I can tell you that communal living has been among the first to receive the vaccination. That's kind of like all over the news,
Right.
Especially it's being one of our high risk categories. Licensed communities have adhered to the Department of Health regulations with screening residents, screening staff, visitors, and requiring clear COVID tests prior to moving into communities. Not only that, they're doing deep cleaning and sanitization throughout the communities. They're requiring appropriate PPE to be worn inside the communities at all times. And seniors are supported to resume their community and to actively engage with their own community in smaller cohorts and little pods within the larger assisted living communities.
Yeah, very good. So how can people find out what type of community will work best for them? How to pick one among so many options?
So in order to really identify, you really need to identify what your loved one's specific care needs are. I like to explain to families that larger communities are based on a social model and can be wonderful if your loved one is ambulatory and has minimal physical care needs. But if the moment that they need 24-hour care and support with all of their activities of daily living. A smaller 6-bed residential care home can be a really good option because they have appropriate staffing with a 2-to-6 ratio and will have more individualized care in a smaller setting. A lot of times you'll see folks that decide to stay in the larger communities, even as they decline or as their disease process progresses, they'll hire in individual caregivers into their apartment. And it can be costly, but if you can afford both of best worlds, then, why not?
Right, right. So what about you mentioned the, affordability, and also what is the typical like cost moving into one of these places? Is it really too expensive? And are there some options to fund this for people who, let's say, don't have a good bank balance?
So you can expect in a larger assisted living community to pay, just depending on the apartment size, whether you want in a studio apartment or a 1-bedroom, or maybe if it's a memory care, if you're going to share an apartment. You can expect to pay anywhere from $6,500 to $9,000 a month in a large community. It really depends on your loved one's specific care needs. Smaller residential care homes are typically around $45,000 to $6,000 per month. However, I will say that, with COVID, there is still a reluctant for folks to move into communities. So as this vaccine starts to roll out, I'm starting to see larger communities in some of the most luxurious larger communities have huge discounts and rate locks and waiving of community fees, which is surprising that they're doing that. And who is going to pay for this? There was an old saying my grandmother used to say, nobody gets a free lunch. That is true. That is true then, it is true today. And unfortunately, Medi-Cal, Medicare will not pay for assisted living. Folks will usually have a long-term care insurance contract or a long-term care insurance policy. Veteran aid and attendance can supplement with some of the cost. Or you're seeing a lot of seniors, unfortunately, selling their last asset, which is probably their house, to pay for their long-term care needs.
Yeah. And once you choose the type of community that might be best for you or your loved one, how do you vet the specific community to make sure it is safe and has no complaints? All those things.
The best way to properly vet any facility and their performance is to check their transparency records with the California Department of Social Services. When you look on their website, you can identify their history of complaints. Do they have a history of personal rights violations? Do they have a history of bed sores or just about anything? You can literally read the reports online, and I strongly encourage every family that's looking into any type of assisted living, residential care home, to check the records. The information is right there in the data. And when you're working with Creating New Hope, that's the first thing that we send to families is the hyperlink directly to the state's transparency records.
That's extremely useful and very, very critical.
Yeah. Especially now, you see operators that have strong administrators and they're adhering to all of the health and safety protocols from the health department and from the community care licensing. Those strong operators have great records and they're staying on top of, COVID mitigation for sure.
Yeah. So what oversight do small care homes and assisted living facilities have, and who oversees them?
The California Department of Social Services oversees all of the licensed, whether it's small or large care communities. And they actually really do a good job of it, and everything is posted online for anyone to take a look.
Yeah, and these are the records you just mentioned. that
Go ahead.
you look into those and then share with people who need to move in, so that they can see if everything is in order, or if they have some serious issues, so they can make an informed decision.
Yep. Everything's there. I like to say the devil's in the details, and that
Right,
is
right.
very true.
Yeah. So what is the cost of placement? Say, for example, an agency like yours, if people are helping, and basically the question is, how do you get paid if people
Yep.
come to you for help?
So referral agents like myself, we're paid directly through the communities. We do not charge families any consultation fee or anything like that. We are a complimentary service provided directly to the families. And what's great about us is we're local, and we don't have any exclusive, well, at least Creating New Hope doesn't have
Mhm.
any exclusive contracts with any communities. We place solely on performance. If there's and meeting residents' needs with like residents. And it's really a process in understanding what your loved one needs and what their likes are and what kind of community they would thrive in.
Very good. So listeners, there is absolutely no cost. So this is really good. You can get like an expert or a team of experts providing you all the information, and there is absolutely no cost to it. It can't get any better.
Yeah.
So what is the information people need to have on hand when they call you for help? Like medical records, finances? What kind of details they need to have?
So really the best way is to call us, whoever is maybe the primary caregiver, or if it's for yourself. I like to have families, if they know like mom or dad would probably do well in assisted living, and maybe they're living by themselves and it's become too much to manage.
Mhm.
If they still have capacity, it's great to bring them into the conversation, to bring them into the virtual tours and see what their likes and dislikes are. And if a loved one has a lot of care needs, the primary caregiver, I'm asking in that assessment, not only what are their likes and dislikes are, but I want to know how they spend their day. How do they spend their day? Who do they like interacting with? What kind of food do they like? So it's really specific to the individual.
All right. Last question. What's the difference between Creating New Hope and, say, A Place for Mom?
So Creating New Hope, I am also a licensed administrator. So I have the same license as the executive director of a large community or a small 6-bed residential care owner. So I'm staying on top of Title 22 regulations. I'm on the forefront of, and every conference call community care licensing has had this year. And I tell you, there have been a lot of calls, a lot of changes, a lot of regulations, and they have done a ton of work on mitigating the spread of COVID and staying on top of, keeping COVID out of their communities. Large organizations like A Place for Mom are internet-based, and they're not local. So they don't have advisors likely that have been inside these communities or know what Title 22 is. So that is definitely the difference with Creating New Hope. We are client-centered approach at identifying quality care for yourself or your loved ones.
And the area that you cover?
All over the Bay Area. So from Contra Costa to Solano, we even have identified some great providers out in the South Bay area.
Awesome. So thanks a lot, Christine, because I think you shared some very valuable information today. And to viewers, I would like to say that when you're looking at this recording, stay tuned and make a note of National Aging in Place chapter. There is tons of information, and we are continuously providing education on various topics that are extremely relevant to our seniors. So this is one of the best places to stay informed so you can take the right decisions. Thank you for joining us today.
Absolutely. All right. Thank you. Take care, everyone.